wish these headaches would go away. Maybe this will help.
Hello, sir. I see that you have a medication with you. Do you mind? We can take a couple minutes and I can talk to you about that medication.
Yeah, absolutely.
Great. Okay, so let me introduce myself. My name is Nyla and I'm a student pharmacist. What's your name?
Austin,
Okay, great. And how old are you?
23.
Okay, and I brought you into the pharmacy today.
Yeah, well, I'm experiencing headaches, primarily like after like classes and when I'm trying to study my schoolwork,
Okay.
things like that. Yeah.
Are you seeking treatment for headaches for yourself?
Yes, ma'am. Mhm.
Okay, and how long has this been going on for?
For a few days.
Okay, and can you describe the pain of the headache a little bit?
Yeah, if I study for like a prolonged amount of time, I usually get the headaches kind of like in the top of my head, kind of resonates down to the back of my neck.
Okay, and
I
how
think.
long would you say they like go on for?
Like 30 minutes maybe.
Okay, and what makes it better?
If I avoid like bright lights, and I've tried taking like warm baths, and they seem to help as well. And if I kind of take breaks from studying my schoolwork, that
Okay,
helps too.
and what do you think makes them worse?
Bright lights, and if I try to focus on my schoolwork for a really long time,
Mhm.
and I guess just stress in general.
Okay, do you have any like other health conditions?
I have asthma,
Okay, and do you use something for that currently?
Symbicort, yeah,
Okay,
and seasonal allergies as well.
okay, and you use something for that as well?
Xyzal, yeah.
Okay, and are you taking any other over-the-counter medications, like maybe supplements or anything like that?
No,
Okay, and do you have allergies to any medications?
no.
Okay, and have you tried to use anything before for your headaches?
Yeah, I try to leave, and it didn't seem to help.
Okay, all right, and smoke?
No,
Okay, do you drink alcohol?
seldomly.
Okay, would you say you drink less than 3 drinks per day?
Yeah, definitely less than that, yeah.
Okay, and do you have any history of like any cancer or anything like that?
Nope.
Okay, and have you experienced vomiting while with your headaches?
No,
Okay, gotcha. Okay, so with the headaches, are you experiencing like any fevers with it?
no,
Okay. Okay, so we're gonna talk to you a little bit about what would be the best to help you with these headaches and like what medications you can take.
okay. Yes, yes, sir.
My name's Zach. I'm a student pharmacist. My colleague told me you came in today because of headaches.
Yep, that's right. Yep.
Okay. I just want to go over some of the goals of this counseling session with you. So our first goal is going to be we want to alleviate your pain. All right. That way we can restore some normality back to your life. That way, you know, headaches can kind of cause a bump in your day.
Yeah, absolutely.
And then we're also going to try to minimize the risk with our preferred treatment.
Okay.
All right. So since you've used naproxen in the past, it's an NSAID. We're going to try something different. All right. We're going to choose acetaminophen. All right. It's been approved for pain. It's just your regular over-the-counter Tylenol. Nothing too fancy with it. It's about 5 cents a pill. And one major indication that we do need to talk about, though, is if you take it in excessive amounts, about 4,000 milligrams, you could experience some liver effects. So
Okay.
we want to make sure that you're going to take it in the form that we go over today with you.
Okay.
All right. And another option would have been salicylates, so like your aspirin.
Yeah.
But we're not going to offer for that today because it does cause a little bit of GI bleeding probabilities.
Okay.
And
Good.
we feel like that's just one of those risks that we talked about we want to minimize.
Yeah, yeah.
That the risk is kind of outweighing the benefits in that treatment.
Okay, sounds
Right.
good.
So with the Tylenol, right, you're going to take 2 325 milligram tablets. It's every 4 to 6 hours. Okay,
Okay,
as needed for your pain.
sounds good.
Right. So the way Tylenol works is that it inhibits these chemicals in your brain called prostaglandins that activate your pain receptors. And so by inhibiting these, it will relieve your pain.
Okay,
Okay.
good.
So it is possible that while taking Tylenol, you could experience a couple adverse effects. You might have trouble sleeping. Your stomach might become upset. You could have constipation. If you're experiencing upset stomach, you can take Tylenol with food, and that should help reduce your. So outside of the adverse effects we just talked about, you also need to be aware that if you start to experience any hypersensitivity reactions, which can include formation of a rash, itching skin. Your skin might become red and blistered. If you also start to experience a fever, or if any of this occurs without a fever, if you experience wheezing or tightness in your chest, you should make an appointment with your primary care physician and discontinue the use of Tylenol.
Okay.
So now we need to talk about the interactions that Tylenol could possibly have. I know you said you don't drink that often, but it's important that when taking Tylenol, you don't drink because it can increase its liver toxicity effects. So we want to avoid that.
Okay.
So if you're going to drink, maybe not take your Tylenol that day, or if you take Tylenol, just remember not to drink.
Okay, so just whatever I do, don't take it with alcohol.
Correct.
Okay.
All right. And then there's also a couple interactions with barbiturates. The barbiturates increase the rate at which Tylenol is absorbed, which can decrease the effect of acetaminophen, but it can increase your chance of adverse liver effects. So it could hurt your liver because you took them in combination. So we want to make sure that we avoid alcohol and barbiturates by using Tylenol.
All right.
If you miss a dose, you don't really have to worry about it. Just make sure that you're not taking more than 4,000 milligrams a day, and
Okay.
right, 4,000. And as soon as you realize, maybe I need some Tylenol now, just go ahead and take it, but don't double up on the doses and take like 4 pills. Just remember to take the 2.
Okay. All right.
As storage goes, you just want to store these in a room temperature place, away from any moisture, probably away from where kids could get them. Okay? Could you tell me kind of how you're going to store your medication?
Yeah, you said room temperature, keep it out of sunlight,
Mm-hmm.
and like out of reach of children and pets, you
Mhm.
said.
How many pills are you going to take and what amount are you going to avoid?
Yeah, I'll take 2 pills at 325 milligrams each.
Mm-hmm.
Okay, and I can't exceed 4,000 milligrams
Right.
in 24 hours?
Correct.
Okay.
Do not want to exceed 4,000 milligrams.
It'd be bad for my liver, right?
Correct.
Okay.
What type of reaction do you want to discontinue Tylenol and seek care from your primary care physician?
Skin rashes?
Mm-hmm.
Yeah.
And just any type of since it's like, oh, I'm allergic to it, like your typical allergic reactions.
I'll know if it's happening, right?
Right. You want to discontinue and seek care. So outside of just prescribing you Tylenol, also want to go over a few non-pharmacological treatments with you. So it seems like your headache is mostly due to stress. You mentioned to my colleague that some things that make it better, there's basically like relaxing things, like relaxing in a warm bath or taking a nap.
Yeah.
Okay. So I think outside of the pharmacological treatment, perhaps whenever you get a headache, relaxing, maybe doing some meditation or taking your naps even can
Yeah.
help.
Okay.
It's also indicated that acupuncture can be really useful in your tension type headache.
Okay.
Right. So maybe you want to try that. It's indicated that about 10 visits over a 5 to 8 week period is extremely beneficial.
Okay.
And then also, perhaps you want to keep a diary of what's causing your headache. So I know you've mentioned studying for long periods of time or sitting in lecture, or those might be stressful situations. Just try to keep track of that and how often your headaches are occurring. If your headache persists after starting Tylenol for the next 2 to 3 days, and it seems like it's not helping, we're going to see you come back into the pharmacy so that way we can explore some alternative options. And I know you've said that it's been happening for a few days now. If it starts to exceed 10 days that you're having these headaches, at that point, I think it's best that you were to go see your primary care physician and get a checkup just to make sure that there's nothing serious going on.
Okay.
Okay. So, in how many days are you gonna come back and see us here?
2 to 3?
Yes, sir.
Okay, dope.
Perfect.
Sounds good.
All right, any questions for me?
No, none that I can think of.
All right, Austin, well, you have a good day, and
Thank you very much.
if you need anything else, just come back and let us know.
Okay, awesome. Thanks.
You're welcome.
The funny thing is that I'm actually experiencing headaches.
That's going in there. Sunlight.
about sunlight.